Dr. Brandie, I am so excited that you are on the Mindful Womb podcast. It is such a pleasure to have you here. And I would love to get started by asking you to tell us a little bit about your journey to pelvic floor therapy and kind of what called you to this work.
It's been definitely a journey, right? So I used to be an educator and I taught chemistry and environmental science. And so I was teaching these college level classes to high school students. And part of the curriculum that I used to have to teach was talking about maternal morbidity and mortality. And so birth trauma, especially in the developing world, came up and I became really interested in the fistula foundation. So, but basically that's where people are trying to give birth and they end up stalling out their labor. So that was one of the pieces. I had to take my own time to heal from my two children. And so I went to pelvic floor PT. So I knew what I knew what that looked like as a patient. And then the other part is that I was a yoga teacher and I taught prenatal yoga. So all those things came together. And then I just had this really moving, powerful dream where I saw myself sitting on like a treatment stool and I had a patient on a table and their legs were covered up. And, there was a sheet there and it was very obvious that I was like a therapist. And I thought, well, wrong number. I'm busy. I'm being a chemistry teacher. I don't want to do that. And then a bunch of doors opened and here I am. So it's been a little scary. But I've been able to help over 1,000 people heal. And, it's a really beautiful thing to wake up every day and go, well, this is just, what we're doing. It's a neat sacred space to be able to help people in this way.
That's incredible. Thank you so much for sharing a little bit about your journey. And I have personally received Dr. Brandie's support and services, and I'm just so excited to pick your brain more because not only have you transformed my life and supported me in my healing, but I've referred a lot of clients to you and they have sung your praises. So I thought we could dive in by talking a little bit about maybe some common signs or symptoms that might indicate someone's either experiencing pelvic floor tension or maybe some trauma that's being held there, maybe from like emotional trauma.
Yeah, so I would say that about 2/3 of my patients have had some kind of birth or physical trauma, sexual trauma, and so it's very common. And the reason I'm seeing so much is there is a sampling bias because if your body has been through something where you feel threatened and in and around the pelvis, there is some guarding patterns, and they're very predictable, right? They show up in each person differently, but what we typically see is we see some changes to bowel movement. So a person may have, they notice that their stool is runny or they always have like a nervous stomach. So there's some interplay with the vagus nerve there, right? And that can actually aggravate the pelvic floor because the sphincters are having to hold back this loose stool because you're always nervous. Sometimes, depending on the type of trauma and how the body takes it, we can also get constipated. And so pelvic floor PTs can help with that as well. There can be, so here's my little vulva, there can be some guarding around penetration at the opening, or we can actually have pain with a deeper penetration into the muscles. So here's the vaginal opening into the muscles deeper in the pelvis. So I do see that sometimes. The autonomics or that, automatic sort of part of our nervous system does run our bladder. So we can start to see things if the muscles are guarding, we can notice that we might have to go urinate more often or more frequently. And we always have this kind of feeling like we have to go. And I see that a lot. And sometimes it can go two different ways. We can have pain with vaginal penetration or intercourse, or we can actually have where we don't have sensation, we have numbness. So we're like not feeling sensation. I saw that already this week. It's Tuesday. I've seen that twice, where they're like, I don't feel anything anymore. And I'm like, well, let's talk about that. And usually those muscles are just as tight as they can be. And the blood vessels and the nerves that go through the muscles kind of get tourniqueted off by the muscle spasm. And then the person is no longer feeling things. So those are some common things that I see.
Okay. And you mentioned, I know, the vagus nerve. For folks who aren't familiar with what that is, can you talk a little bit about the vagus nerve and why that's kind of important for folks who
Yes.
are maybe exploring pelvic floor therapy or how that impacts your pelvic floor?
So there's two parts to this autonomic. So this part of our nervous system that we can't control. There's the sympathetic, the fight or flight, which most people have heard of that. And then there's the parasympathetic. And so that's going to be where we're resting and digesting and feeling safe, right? So right now we're able to talk and feel safe and comfortable like mammals with each other. So we're in this nice like ventral vagal state. So, but bottom line is there's a nerve that comes out from behind your ear and it goes down. It goes to the voice box, larynx and pharynx, all the things in your throat. It controls your heart rate. It actually slows the heart rate down. Without the vagus nerve, like when you have a heart transplant, your heart rate is always going to be much faster than without it. So there's this vagal braking. It slows everything down. The sympathetic nervous system is always going, and then the vagus nerve and the parasympathetic slows it down, right? So we want it to be active. We want to help slow things down. So it also goes into stomach. The stomach, the liver helps to make digestive enzymes, helps to keep things moving along. And then it goes into the small and into most of the large intestine. There's actually a branch that goes into the vagina, which a lot of people don't know about. But basically, if we have some kind of trauma, depending on what happens, we can kind of get stuck in a fight or flight. Or, if the person is in a situation where they go into a shutdown because their body the fight or flight doesn't work and they sort of have to give up. It will cause things to slow down. And that's where we see people that are depressed or maybe they are not feeling things. They start to have very slow digestion. So if the vagus nerve is not really as active as we'd like it to be, people can be stuck in anxiety and maybe they have the nervous gut, the runny stools. Maybe they always have a faster heart rate. Or it could be if we've been through enough trauma and the body's taking it very hard, we can go towards shutdown, towards depression. And that's where we're seeing the bowel slow down. So, and we lack sensation.
Wow. Okay. It's so interesting to understand how all of these systems are so interconnected.
Yeah.
So, can you talk a little bit about how pelvic floor therapy works to address and release any of this like stored tension or trauma in the pelvic region?
Sure. So, as far as what I do, and with you being a client of mine, if it's okay, I won't go into your history, but every single person that I see, I start working on their abdominal wall. And the reason for that is because the vagus nerves have the vagus nerve has so much branches to the abdominal wall. So I actually have this in my office. So I'll start to kind of check in with the digestive system, making sure that there's a few valves along the way here that have a lot of parasympathetic branches. So like this model's awesome. There's a little valve here between the small intestine and the large intestine. And so like I can actually, on a person, I'm going to stand up and show you, like this guy lives right through here in the lower part of my abdominal wall. So if I were to touch this area and just to give up some simple kind of slow techniques here, it can really start to slow things down. I can hear some gurgles as the guts are moving on the person. They may yawn, they may look sleepy. I'll notice their breathing rate can slow down a little bit. And so I'll start with some gentle visceral work. So not all pelvic floor therapists have visceral training, so the abdominal wall, but I do, and that's where I start. And as far as the trauma response to the pelvic floor itself, doing some internal work. If we think about breathing and how we can interact with the nervous system there, I'm going to stand up again. As I inhale, right, my respiratory diaphragm and my pelvic diaphragm, my pelvic floor, they should be able to relax and soften. However, if this is clenched and held up, that can really inhibit how much of a deep breath I can take, right? So if I start to do some internal work or external work on these muscles, and then we can start to take a deep breath, I'll hear my client say, wow, I can actually breathe now. Because breathing is the only way you as a human can directly impact what that autonomic nervous system is doing, right? Because that's kind of our input to the system. So the biggest way that pelvic floor therapists start to help the vagal nerve function is to be able to help a person take a good breath and find their way back to the body through the breath. So, yeah.
Wow, that's incredible. And I remember in our first session, like you had done some of that work and I could feel like my digestive system interacting in a way like where there had been so much tension and like experiencing such instant relief. It was amazing.
Mm.
So Are there any, you mentioned earlier, like sexual trauma, birth trauma.
Mhm.
Are there any other types of traumas or maybe even like life experiences? I
Yes,
know I've heard folks
absolutely.
who are like horseback riders and things like that may tend to hold more tension in the pelvic floor. Can you talk a little bit about that?
The biggest one that I see, it's actually it's so much more common than riding a horse. That's certainly part of it. It's people that are perfectionists, right? People pleasers, people that don't want to get angry, people that don't want to mess up. So that tension from having to be perfect all the time has to go somewhere. And so I would say no. I've seen over like 1,000 people, so I don't have data on this, but I would say 90% of my people that have overactive pelvic floor muscles, they are like straight A students. They're the boss. They do all the things, and that's great. But like when you have to have your life together all the time, and you're always like, oh, I hope I do this right. The body, I was reading the other day. It's kind of interesting. The body does 4 things when we have stress or pain or trauma. We curl our toes, we clench our pelvic floor, we shrug our shoulders, and we clench our jaw. So almost everybody with pelvic floor stuff has jaw pain, or they always like feel tension, or they have headaches. So those are like in a little party together. But I just get to mostly interact with the pelvic floor part. But I have to treat people's, jaw and neck quite a bit. So perfectionism and being like the good girl or the good guy, where you always like have to make everybody happy and people pleasing. That'll do it. 100% done.
Wow. That makes a lot of sense. It makes sense why I needed pelvic floor therapy. Um, so can you provide, and honestly, I'm an open book, so you're more than welcome to talk
Okay.
about my experience with you
Sure.
as well. But
Mm-hmm.
whatever kind of examples that come
Mm-hmm.
up for you as some individuals who've kind of benefited from pelvic floor therapy, not only because they're experiencing the benefits in their physical body, but also helping them process and release trauma.
Sure. Sure. So there's a couple different things. There's a couple different holding patterns that I see day in and day out, right? So let's say that someone has some trauma and it has to do with the pelvis. And this could be just like, it doesn't have to be birth, it doesn't have to be sexual trauma, but let's just say you had your first pap smear didn't go well, or you had an ultrasound down there and it was like, they didn't explain it. When people have something that happens too fast and too aggressively that their nervous systems can't respond and they don't feel in control, people will go into a guarding pattern. So what I will see, and I'm going to stand up and show you my crotch if that's okay, but like if you can see the seam of my pants here, oops, if you can see the seam of my pants, the inner thigh muscles, they go down and they join in with the pelvic floor just like a seam of the pants. So before I ask for consent to enter into someone's vaginal area or into their rectum if they're a male or have a male anatomy, I actually will check the inner thigh muscles. If I'm standing beside somebody, these pelvic floor muscles, they move the leg around. So I'll ask them just to rest their leg on my abdomen or on my hip. If they can't let their leg relax into me and I start to notice a little shaking in their leg, then I know that something has happened too fast or too aggressively for this person. And so sometimes that can be kind of innocuous. You're like, oh, you know what? When I went into my checkup, the doctor, did this and that. And it's not like trauma, but it was. And then, as we start to work on the inner thighs, the person will start to, even if they're not aware of it, they'll start to tell me the story of the thing that's making their legs do that. And a lot oftentimes as that trauma is worked through, we will either do some hands-on stuff. I love to do dry needling because it's like a control alt delete, which is like acupuncture needles, but we put them into muscle spasm. The person will kind of, sometimes they'll have an emotional release and they'll cry a little bit, or they'll go, oh my gosh, when I was 11, I'll tell you this story because it's not too disturbing, but this person was like, when I was 11, I like somehow tripped and like landed on a stool weird. And I had this hematoma on my vulva. And she was storing that the whole time in her inner thighs. It was fascinating. But I hear a lot of stories at this point, just with the inner thighs. And if somebody has something like vaginismus where we try to insert something and it won't go in, first of all, get medical treatment because that's a thing. It's not in your head. But the inner thigh muscles, because those tissues coming in, oftentimes after I just work on the inner thighs, I'll be able to insert finger and start to work on the internal part. So that's one big guarding pattern that I notice. And then the next one that I notice is I bring in my model here, not the muscles at the opening, but the muscles about this far in, about 2 knuckles in. These little guys here, if you have ever experienced using a tampon or having intercourse, anybody that's listening, and you feel like something's hitting a wall, that's typically the wall muscle. And I've probably heard 100 different stories as I start to touch that muscle of when I was having my baby, I didn't want to be in this position. I wanted to be in that position. Or when I was younger, I was in a situation with this person and they did this. And so it's immediately at this point where we give them a second. I take a break, I step away, I make sure I'm lower than them so they can like feel safe, get them a therapy referral if they need it. But it's amazing. I'll let them have their emotional release, go back, touch the muscle, and it will be quite softer. So those are the two biggest things other than the bowel issues that I see kind of day in and day out.
Wow, thank you for outlining that.
Yeah.
That's really helpful. Are there any, and I know you've walked through some for me individually that made sense with what was going on in my body, but
Mm-hmm.
for listeners, do you think that there's any kind of self-help techniques or exercises that someone can do in kind of like a daily routine to support the release of their pelvic floor tension
Yes.
and related trauma?
Yeah. So
Awesome.
if you can see me, if you end up watching this with a video, great. If you can't, if you take a big breath and you notice your shoulders go up next to your ears, that's a really good sign that you're not letting your pelvic floor drop down through the day and you're getting clenchy. And then you're kind of living up into the jaw tension and the neck tension that I mentioned. So that the best and easiest reset to bring the breath down into the abdominal wall and so that the pelvic floor can descend and stretch as we inhale is to lay on your tummy with a soft pillow under your belly button. Hands are placed under the head and then just to open the jaw. And I call this breath a slow motion gasp, trademark Brandie Freeman. It works though. So if you open your mouth, sorry, it's ever since I made up that cue, I have not had a trouble teaching a client stuff. But if you'll open your mouth and then pretend you're watching a movie and you'll breathe down into the pillow as you lay on your tummy. Set a timer for 5 minutes. Soft music. It'll get your breath back down into the viscera, the guts, and then that pressure of the soft pillow, as long as it's not triggering to you, will help to give that kind of hug on the outside to your guts. The guts love, as long as it's gentle, they love that gentle pressure, right? And they love to be moved in and out with the breath as it goes down and up. So if we're lifted up in the shoulders, the guts and the pelvic floor, they're not getting that gentle descent with our inhale. So laying on your tummy like this, hands under the head, and breathing for 5 minutes. That'll fix a lot of things.
That's awesome. Is that safe to do in early pregnancy, or would you do like an alternative so that you're not laying on the belly?
I think if you're finding that, for the first few weeks of pregnancy, yeah, you're fine. And then you can ask your provider about when you don't want to be laying on. Usually when people start to show, they start to be uncomfortable, but the baby's swimming around in a little swimming pool, so they're fine for a little bit there. But if that doesn't work, when people are a little further into their pregnancy and they're starting to think birth prep, I love to do what I just talked about in a deep squat, but you're going to take your hands on a door frame, stand in the door and hold onto the door frame with your hands, and then go all the way down into the squat. Have your knees nice and open and use your hands to support you so that you can just breathe down into the pelvic floor. Happy baby or some inner thigh stretches are great, but sometimes they're triggering for folks for that same reason I just talked about with the inner thigh. So that's not always my go-to. But side lying is great just because the abdominal wall can relax down and gravity is helping you. So yeah.
Oh, that's great. Thank
No
you.
problem.
And I feel like you've already touched on this because there's such a mind-body connection in what you're already giving voice to. But can you talk about the role of mindfulness and what that plays in this healing process, in the release, and how you integrate that into how you practice pelvic floor therapy?
Yeah. So basically, as I'm doing these different techniques with people, I'm always asking for consent. I can tell what's going on with my hands to a certain degree, as far as what's tender before a person can tell, or what might feel maybe less comfortable to somebody. And I really monitor that and I honor that. However, a lot of people don't feel down there at all. They just are like checked out. So if I'm helping somebody prep for a birth and you can't ride the sensation of my finger and like follow where I am, that's going to make it harder for you to hang through a contraction and like to be able to breathe down into the pelvic floor if you don't know where your pelvic floor is, right? So I will stop and say, everybody can do this, no matter if you're listening or hearing me or watching me. But if you take your finger and touch the end of your nose, see how it's squishy like that? That's what your pelvic floor, if you stick your finger inside your pelvic floor, that's what it should feel like. If it feels like the bridge of your nose and it's hard, that's a muscle on a spasm. So I try to bring awareness to the patient as I'm inside the vaginal canal for my expectant folks. But like I want the muscles to feel soft and kind of squishy. And I'm saying, hey, can you feel where my finger is? A lot of people will say no. They're like, not really. And I'm like, well, feel how it's moving. So that mindful piece, we start to cue into movement. It's like, can you feel me moving? Can you feel how this doesn't move? And then I will have them breathe with that same slow motion gasp if needed down to the area that I'm working. But I think as we go through our days, we don't really pay attention to the pelvic floor. So sometimes it's like a back and forth, or if I'm working on the abdominal wall, I'm like, can you feel how maybe this feels a little tender? Or do you feel this little kind of area of tightness here? And I'll have them take their hands and touch. But people don't pay attention to their bodies. And when the body doesn't feel, it creates pain. So people with like, for example, diabetes that have polyneuropathy, their nerve cells to their feet are gone. They cannot feel, but their pain down there in their feet is excruciating because the body will create pain where it can't feel. So it's like when we can start to reconnect to these areas of the pelvic floor, especially if they've been in spasm, sometimes that's where we get our emotional release because I'm asking them, if the body doesn't feel something, it's doing that on purpose, right? It's like, I'm not safe. I'm not gonna. So that's, the mindful thing is something that I actually have to titrate and kind of do slowly because sometimes when people don't feel, there's a reason.
Right, right. And it can be kind of opening the floodgates too
Yep.
quickly, right?
Yep.
So doing that slowly and intentionally so it doesn't feel jarring or re-triggering.
Mm-hmm.
Yeah. Um, I'm wondering, so a lot of people, I feel like pelvic floor therapy in general is gaining more awareness and
Mm-hmm.
traction. I think that that's happening writ large. Maybe it's because I'm a birth worker and I'm working with more people and
Yeah.
they get it.
Right.
But I do think that a lot of people think pelvic floor therapy, this is something that I might engage in postpartum, but they
Mm.
don't really think about it prenatally. Can you talk a little bit about why it's important to see a pelvic floor therapist before you're going into labor, before the very end of your pregnancy?
Yes. So, yeah, I deal with this every day. I'm sorry I'm laughing, but it's one of those things where it's a good question, but it's like, why are we still asking this? Like, if you're, let's say you're a gymnast, right? And you're like, I want to go work out at a gymnastics competition, but you can't touch your toes. Like that's going to be really humbling when you get down on the floor, right? And you're like, I don't know how to do this. So there's a preparation that happens there, right? So I have women that have histories of pelvic pain, difficulty with penetration. Those are the same muscles that won't accept a penis or a toy or whatever. And then a human's supposed to come out. That's a big stretch, literally. Like that's why don't you come in and let me help you with that? And even if you don't have a history of pelvic pain, there's good research that supports that. Doing perineal massage, which I show people how to do in my office, prevents high grade tears. So out of the 1,000 people I've worked with, about 250 were pregnant. I've had no grade 3 or 4 tears, and very few grade 2s. Right. So if we can get the tissues moving, you're going to recover better. So however many times I see somebody when they're pregnant is a visit I don't need afterwards because I don't have to fix as much, right? So that's kind of cool. But we can show you how to breathe and brace to help prevent diastasis recti from getting too far gone. Everybody's going to have a little bit when they're full term. So we can prevent those things like tearing, diastasis recti. And then the other thing is, if you are, depending on where you're birthing and how you're doing that, if you are not educated about your options, how to push, they're going to tell you to hold your breath and bear down. Well, that leads to more tearing and prolapse, which is where your organs make their way pushing into the vaginal wall and towards the opening. We don't like that. But if you don't have education and nobody's told you how to do it, you're going to do what they're telling you. And that's not always in your best interest, depending on the situation. And, you should always listen to your medical provider's advice. But at the same time, maybe let's learn how to breathe baby out instead of forcing baby out by holding our breath. And just the pelvis, it moves, right? So I'm going to show you, and pelvic floor therapists can show you how to kind of optimize the femur position to get baby through different parts of the pelvis. If you just lay there because you don't know what to do, you're going to make your life a lot harder and more uncomfortable. So it's like preventing things, having easier birth, and then when you're there, you're going to feel more empowered and knowledgeable. And that's going to prevent trauma. Trauma happens when things happen too much, too fast. And if you don't have an awareness of options, then you're going to be more apt to have trauma.
100%. And I think there are myths out there that pelvic size is like a major contributor of why babies cannot come out.
No.
And that's been debunked,
Yep.
like big time debunked. And I think what we see more often if we're not seeing baby descend is because of pelvic floor tension.
Yep.
So it's less of talking about there are issues with your actual physical anatomy of your pelvis. Again, like Dr. Brandie just highlighted, like your pelvis is mobile. If you're getting into different positions and your baby's head is, like the plates have not fused,
Right.
like it can move into optimal shapes to fit through your pelvis, but changing your position is terrific. But then working on those pelvic floor muscles go a long way in terms of, supporting baby in that release down into the pelvic floor.
The way I explain it, if it's okay if I make an analogy, the uterus is like a tube of toothpaste. So it's going to squeeze down from the top, right? Its job is to push your baby out. Coming to see a pelvic floor therapist before you have your baby is like learning how to take the top off the tube of toothpaste. So your uterus is going to push your baby out. What it's going through is going to be largely dependent on how much you move and how open your muscles are and how you know how to breathe down into them.
100%. I personally, as a doula, I recommend that all of my clients go establish a relationship with a pelvic floor therapist prenatally to get support, and then continue postpartum as well if they see that there is a need. So, could you talk a little bit about if someone is in postpartum, what are some of like the myths that we've been told? Well, that just happens after you have babies, versus no, this is pelvic floor dysfunction, and you could go to a pelvic floor therapist and experience a lot of relief.
Sure. So basically, I'll take this by system, right? So if we think about urinary stuff, you shouldn't be leaking. After about 2-3 weeks, you shouldn't be leaking anymore. The first couple of days, yeah, sure. After that, no. By the time I see you at 6 weeks, we should not be leaking. If you are, we got to do some work. That's fine. If you notice that you're peeing more often or that you're having to hold back on how much you drink because you're having to urinate too frequently, that's a problem. So as far as bowel stuff, hemorrhoids, okay? Hemorrhoids can be caused by pelvic floor muscle spasms. So here's your anal opening. This little muscle here, already today, I saw this. This muscle here, the levator ani muscles, they go from the pubic bone to the tailbone. If they're tight, they'll act like a blood pressure cuff and keep the blood from coming up from the anal veins back to circulation. And so if this is relaxed, then you won't have a hemorrhoid anymore. So hemorrhoids, oh my gosh, we can help with that. Please get pelvic floor therapy, especially if you're, wanting to do like a hemorrhoidectomy. Please don't do that. If you're noticing, again, changes to the bowel and you're constipated, it certainly can help with that. The biggest thing is like, if you have a tear, or even if you don't, let's say, I had a lady, a tiny 5'2" lady, came to me prenatally, had a 10-pound, 9-ounce baby, no tearing, 0, none. You can do it, okay? But when you have that big of a human coming out, the pelvic floor is stretching, and then it will kind of go back to its size, and it'll be like, and so there'll be some spasm even if you don't tear, especially if you have a larger baby. So if you start to have intercourse and it hurts, the muscles will actually guard because they are like, oh, things are not going well. So any kind of pain with intercourse, please get pelvic floor therapy. Don't just wait until to see if it gets better, because it probably will get worse, right? Because the muscles will start to guard, and that will add to the discomfort you're feeling. And then I will say, as far as abs go, if you have a diastasis, I already, with my hands today, took a lady with a 2.5 finger gap and took it down to 1. And Google me, like you can read my reviews. I'm not making that up. We can help if you have somebody that's skilled enough that works with you. We can help your diastasis come together. You don't need to necessarily like buy some kind of program from Instagram. and be scared to death from moving. Like, we can help you heal your abs and you don't have to have a surgery. You're getting all my pet peeves, aren't you? I'm sorry. Those are some things.
Yeah, that's really helpful. And then what if someone has had a surgical birth, like a belly birth, a
Yeah.
cesarean?
Yeah.
I think sometimes people think, oh, like baby didn't come out down there. Like I don't need to go to pelvic floor therapy. Can you talk about how pelvic floor therapy can still be beneficial maybe for folks who have had surgical births?
Of course. Here's my pelvis. Here's the pelvic floor. You can see it's really close to the top of the pelvis. Here's a cesarean cut, right? So what ends up happening, they don't cut the ab muscles. That is not correct, but they do move them out of the way. So there's still injury to them. They cut through 7 layers though. So when the abs have that much injury and that much stretch and the rest of the tissues are obviously traumatized, what can end up happening, and I see this pretty often, is the pelvic floor starts to compensate for the abdominal muscles. And then they go to have intercourse and it's tight and they cannot have penetration comfortably. That was my 8 o'clock patient today. You're just bringing up all just a normal day for me. But that's, that's okay. And so we can work on that. If you notice that your abdominal wall is numb, right? Imagine sitting in the floor, crisscross applesauce, and then your feet go to sleep and I ask you to walk around. Your legs will work, but are they working well? Mm-mm. So if your abdominal wall is numb and then you're noticing your core is weak, that's not helping. So you can do different soft tissue stuff. I dry needle C-section scars to get them to wake back up and have sensation. So that you shouldn't have a whole like patch of skin that you can't feel in your body. That's not good. And the other thing about scar tissue is it continues to proliferate and grow over your lifetime. So if you can get someone to do a soft tissue work and learn how to work on the scar and do soft tissue work there on your own too, it will help to prevent those adhesions. So yeah, I would say it's actually, my opinion, if somebody has a C-section, they need pelvic floor therapy more than someone that has a vaginal birth.
Mm-hmm.
So
Mm-hmm.
yeah.
Right. Misconception out there.
Yeah.
Right. Yeah. Well, do you see any other like key elements that oftentimes is either a misconception that is preventing someone from getting pelvic floor therapy when they need it,
Mm-hmm.
or something you wished more people who were in their, childbearing years and like planning on having a family, some like key
Mm-hmm.
things of advice that you would love to instill upon them?
Sure. Well, the first thing is every single state, all 50 states have direct access. We have doctorates. I have a doctorate in physical therapy. And so you can, as a human, go off the street and go to a pelvic floor therapist without seeing your doctor first. I mean, if there's a medical issue or you have something, if you're pregnant, we love to make sure that we're on the same page with your provider, but you can, if you're having pain or you're having leakage or whatever, you can go straight to a pelvic floor therapist in your state. So you don't have to get permission from your medical doctor to see us. We have our own kind of doctorate. And so, there's a certain period after that you might need a plan of care signed or a referral, but you can see and be evaluated by a pelvic floor therapist without getting permission. It's kind of like getting permission from your provider to drink during birth or have a snack. It's like, why are we holding people down? Why are we keeping people from living their best life? Right. So that would be the biggest thing that I would say. And then the other thing is, I find that things don't get better, they get worse. So if you think about your grandma or your mother and they're wearing pads or maybe grandma's in the nursing home and she's wearing a full-fledged Depends diaper situation, that didn't start when she was 80. That started when she was 25 and it got worse and worse and worse. And so the number one reason that people are in nursing homes and cannot live independently is because of incontinence. And so it can take a little bit of time and a little bit of resources to see a pelvic floor therapist, but we can prevent you from having that as the end of your life. We can prevent things like prolapse surgeries from having to happen. Again, we can help with the diastasis. We can help with pain with intercourse. We're very handy. So if you have a surgery, you can't go back and see what would happen if you just tried physical therapy first. If you try PT first and it's not a PT issue, we'll let you know. I certainly let you know. But you can always do the surgery or whatever medical intervention later. But there's so many things that are just muscular that I'm usually the 8th or 9th person somebody sees, not the first person. And the people that see me preventatively, they have a real easy time of whatever they're trying to do.
Yeah, I mean, I can speak to my own experience with that too. I went to my primary care doctor who was like, "Well, it's not a UTI, so sorry you're in pain, but like nothing's wrong." And I was like, "There is obviously something wrong. Like I'm having rectal pain.
Mhm.
My like GI system doesn't feel good. It feels like there's something happening. My pelvic floor is not right, And
Mhm.
I thought then, okay, I'll go and see my gynecologist and got
Mhm.
all of these tests done. Oh, you're fine. Go and see Dr. Brandie. Literally after one session, so much better.
Mhm.
You were like not pushing your services on me at all because you're like, I just want you to feel, I want you to feel good. You don't have to come back. You could come back.
Mhm.
And I waited. And then I was like, I want to go back.
Mhm.
And totally worth going back for a second time. I have experienced such a change in my lived life. Like
Mhm.
digestively, I'm feeling better. I'm not having as painful periods. I'm not having as painful. I was having like random like rectal spasms. Like there are just so many things that I started to like normalize in my
Mhm.
body or tension I was holding. And I still do my exercises that you gave me
Yay!
that have like helped maintain my pelvic floor health. And I cannot speak more highly of pelvic floor support, regardless of if you're in your journey to parenthood. But it's definitely one of those things where an ounce of prevention is worth a pound of cure.
Of course.
Um,
Did we give you a
so
wand? Can I ask, did I give you a wand?
you did give me a wand. I love my wand. I wish I had it
Yeah.
here to show folks.
It's pretty
Yeah.
cool. I mean, I have one over here, but basically, the thing about us as physical therapists, we want you to be functional, right? I always kind of joke and say, I'm not trying to be your forever friend. Sometimes I need to support people over a long period if they have chronic stuff or trauma, but like, I think physical therapists we're not surgeons, so we don't want to cut you open. We're problem solvers. We look at the function and we figure out what's going on with the tissues, nerves, muscles, and then we try to get you better. And we show you how to change your life as far as how you go about your day and then how to take care of yourself. So we really are, I feel like as a profession, more nurturing and more independence givers. I'm going to grab my wand. I will show you guys. So I love these wands, and I actually show people how to do perineal stretching with them. But you can sort of insert them into your vaginal canal, and you can massage the muscles on the inside. So you kind of have a little bit more sense of agency as far as self-care with them. So it's nice because some people do store their tension in their jaw and pelvic floor, and so it's nice to be able to go like, hey, I can treat myself. Because when people feel like they don't have an answer and they don't understand what's coming from, that actually increases kind of that volume knob in the brain of pain when you don't have that internal locus of control. So
Yeah, 100%. And for someone who struggles with perfectionism, I'm also autistic. Like, I mean, there's just so many areas like where my masking trauma, where my sexual trauma, like so many different things in my life have been held in my pelvic floor. Like that is where I held it. And getting dry needling, having the internal work that you did, having the exercises and those skills have like given me a sense of agency, freedom, and like an understanding of my own anatomy and where I'm holding tension in a way that's been so liberating. So anyone who is listening, like one, if you are in the greater Atlanta area, check out Dr. Brandie. I'm so sad now that I'm in Massachusetts and cannot be in her care if I need more pelvic floor support. But I know from multiple clients who have gone to see her, I know from just in general, everyone who goes to see Dr. Brandie is very happy that they did so. And
thank you.
I would definitely recommend checking out her resources as well on Instagram. If folks are interested in following you, learning more about your practice, how can they follow you or learn more?
Well, for the greater good, pelvicrehab.com is where you can find a pelvic floor therapist in your area if you're not near me. If you are near me, come on in. But I'm at Connect Pelvic Health on Instagram, and Connect Pelvic Health and Physical Therapy is on Facebook. And then connectpelvichealth.com is where we are. So
awesome. Thank you so much, Brandie. I really appreciate your time today. And I know our listeners got so much from all of the information you shared.
it was a pleasure. I appreciate you having me on, Clara.
Thank you.